Hi, I'm Ilene Ruhoy. I'm a board-certified neurologist and the Chief Medical Officer of Vasper. So I went to medical school at the University of Pittsburgh, and I trained in both pediatric and adult neurology at the University of Washington in Seattle. I am very much interested and have trained additionally in mitochondrial medicine as well as integrative medicine. I'm also a certified medical acupuncturist and have taken lots of additional intensive trainings in herbal formulations. I also have a PhD in environmental toxicology. So my goal is to combine all of these areas of my training and my experience and my background to really help people formulate a lifestyle that helps to maintain optimal wellness. When I first learned about Vasper, I was so excited because there are physiologic phenomena that we've always sort of known, and Vasper capitalizes on that. We've always known that blood flow restriction seems to reduce oxidative stress and enhances mitochondrial function. We know that cooling actually preserves tissue as well as causes vasodilation, so enhances blood delivery. And so Vasper is not just an exercise program. And not everyone can do high load, high intensity exercise. So Vasper takes low load, low intensity exercise and combines it with blood flow restriction along with cooling. And so it combines these very remarkable ways physically that our bodies can on their own harness healing powers to improve inflammation or immunomodulation or detoxification of different exposures that we have in our daily environment. And so I think it's a real critical piece to overall health and wellness. I definitely think over the years at the different conferences that I've spoken at, people are way more receptive than they used to be. I think we're starting to realize that pharmacologics play an important role, but they don't play the complete role. And then there's a lot that we can do in addition to any conventional treatments that we might offer to really help whatever it is that we're feeling, whatever it is that we're suffering from, and to really help improve that. And so I think a lot of people are interested in what more they can do. So it's not just about what they're prescribed and have to take, but what they can do on their own time, and how they can better their lives and health. We have 2 Vaspers currently in our clinic, and I recommend them to people wherever they live if they have access to a Vasper. I use it for just about everything. So we see a lot of neurodegeneration, we see a lot of chronic fatigue, we see a lot of complex illness, we see a lot of TBI and concussion patients. And so I have found that they all can benefit. They have such improvements. We have people who have not had feeling of control over their cognitive capacity for a long time and have had cognitive decline from various etiologies, whether it was physical trauma, emotional trauma, exposure trauma, infectious trauma. And they get on the Vasper and they do a few sessions, and certainly when it's regular sessions, they start to feel improvement in the way their body feels, and the way they sleep, and the way they think, and the way they process, and the way they move. Some people have been able to return to work full time, but everyone reports some benefit in their symptoms. And so it's been really a remarkable modality to include in treatment programs that, again, is not pharmacologic at all and helps people move, but at a more optimal, efficient way, so that they really do show improvement. And it is exciting, not only for them, of course, but for me as a neurologist. It's what I hope to do for them. My patients keep wanting to come back for sure for more Vasper sessions. They book them well in advance because we are actually fairly busy on the Vasper. In fact, we started off with 1, we got a second, and now they're both being used regularly each day. And I'm thinking about getting a third if I had enough room. But they keep wanting to come back more. We've had a couple of patients just purchase their own in their homes, but that's not obviously easy for everyone. So they come for sessions here in the clinic, but they are very excited about this therapy. Most of them have been on multiple medications for many, many years, with some benefits, though usually suboptimally, sometimes no benefit at all. Sometimes they cannot tolerate the medications because we have a lot of patients with very sensitive constitutions because of their disease. So sometimes the medications don't work for them at all and can actually make them worse. So the fact that they have found a therapy that has only shown them benefit and allows them to do what they're reading everywhere they should be doing, which is exercise, right? Open up any magazine, look on the internet, turn on the television. People are talking about the benefits of exercise because it's absolutely true. It's been documented over and over again. And finally, a way that people who have been chronically ill for a very long time can actually gain the benefits of exercise and more, because again, it's not just exercise. It has these additional capacities to improve health in an exponential manner. So there's already been some research with regards to the benefits of Vasper. It has shown to improve certain metabolic disorders with regards to how it helps the body to create normal balances of hormonal levels. It also has been shown to improve and enhance mitochondrial function, as well as to improve the production of stem cells. But we hope to bring research to a much higher level, and we hope to do research where we're actually objectively proving the enhancement of mitochondrial bioenergetics, as well as to improve neurogenesis. We all maintain the ability to create more brain cells, more neural cells. We have neural progenitor cells in our brain. We have the capability of neurogenesis, and we hope to be able to objectively prove that the Vasper therapies actually help enhance neurogenesis for all of us through all decades of life. And so we have lots of research planned with regards to mitochondrial bioenergetics, neurogenesis, anti-inflammation, and immunomodulation that I'm really excited to be a part of. As the Chief Medical Officer of Vasper, I am really excited about bringing it to the world of medicine, because I think for a long time it has been used for those who have to maintain a certain elite level of fitness with regards to physical performance or cognitive performance. But we now know its therapeutic values, and I think that it can change the world of medicine, it can change the world of rehab, it can change the world of therapeutics. So I'm real excited to bring this technology to a world where people can really benefit and start to improve in their health and overall well-being.